LeAnn, what is too much pain to experience during your period? Is there a threshold that should be expected? And what are some ways that we can, as women, treat ourselves for these kind of menstrual cramps? And when do we start to need to bring them to a provider like yourself?
Yeah, so I think that's a really good question. I think a lot of women feel like they need to be on their deathbed before they come in to the provider for their periods, and that's just simply not true. Pain is very relative to each individual, and what may be excruciating to somebody will be totally normal for the next patient. And I think it's really important that everybody knows that their pain matters and that their painful periods matter, and that they shouldn't have to suffer through their period every single month. Some of the most common things that people can do for painful periods at home is taking a non-steroidal anti-inflammatory like ibuprofen or naproxen. They've been proven to be the most effective in treating the inflammation that occurs in the uterus when you're having your period, and it can be very effective in treating period pain. Other options that you can do at home would be using like heat. They've found a little bit of research that has shown that acupuncture can be effective for treating period pain. Massage, exercise, things like that are all helpful. But if after a few months of using ibuprofen regularly or doing acupuncture or anything like that, if your periods are still not improving, we want you to come in to be evaluated. We kind of break down heavy and painful periods into two categories. One, primary dysmenorrhea is what we call it, where it's just based on your period. There's nothing structurally or anatomically incorrect. It's just your period. And then secondary, where there's something that can be treated, like endometriosis, PCOS, things that are causing these painful periods. So it's important to come in and be evaluated and rule out any other causes and make sure that you're getting treated.
So if you were to go to your provider and they said, you know, we're looking at a PCOS or endometriosis, what would the treatment for that look like?
So we would first do like a pelvic ultrasound to see if there's anything specific that we can see. Do you have fibroids? Do you have PCOS? And if there's nothing specific that comes up on an ultrasound, for somebody who's having very painful periods, we would often recommend doing a laparoscopic surgery to go in and look and see if you have endometriosis, because that's the only way that it can be accurately diagnosed. You can't see it on the outside. So unless you go in surgically, you can and actually see the endometriosis, that's the only way to actually diagnose it. And that's why so many women go undiagnosed, because they're told, oh, there is nothing seen, you don't have anything wrong.
Yes, and then they suffer with painful periods for a very long time.
Yeah, and that's just unnecessary.
Absolutely.
We don't need pain on top of the bleeding.
No.
I know it's our curse, but anything we can do to alleviate that, I am all for.
Yes.